Hi everyone, it's Dr. Ramani. So today we'll be talking about importance of folic acid in pregnancy. So what do we mean by folic acid? Folic acid is also known as our vitamin B9, which is an essential nutrient needed during pregnancy, and it is one of the essential prenatal medication, or something we call hematinics, which include other drugs such as vitamin C, vitamin B, ferrous, and the likes. So what this folic acid actually do is that it helps to prevent some severe birth complications or severe birth defects in pregnancy, which also help in the development and growth of the mother and the fetus. So we're talking about the key importance of this folic acid. So the first one I'll be talking about is it helps to prevent neural tube defects. What do we mean by neural tube? Neural tube. It's the one that develop into the spinal cord and the brain. So if there is deficiency of this folic acid, these defects occur. Example of the defect that could occur is called spinal bifida, which is incomplete development of the spinal cord, and another one is anencephaly, which is incomplete development of the brain. So this folic acid is an essential nutrient. Another thing that it does is that it supports formation of red blood cells. This folic acid combined with other nutrients such as iron, vitamin B in the gut, that is in the intestine, to form red blood cell, which helps to reduce what we know as anemia, which is shortage of red blood cell in the body, and it helps to increase delivery of oxygen to the fetus, and it helps in the growth of the mother mother development also. So another thing is that it helps in promotion of fetal and placenta growth. What it actually do is that it helps in the support of the growth of the placenta, which in turn helps to deliver nutrients to the baby, and it's also helping the DNA synthesis and cell formation in the growth of the baby, which is very vital in early pregnancy. That is why when you go for your antenatal, they tell you to take your folic acid when before you start planning to get pregnant, because it helps in growth of the baby. So another thing is that it helps to reduce risk of preterm delivery and low birth weight. The thing that it actually does is that it helps to reduce any risk of having to give birth before the appointed time, or to give birth to a small baby, that is the weight of the baby. It helps to prevent um, low birth weight baby, and it helps to prevent the risk of having miscarriages. So another thing that it helps to do in the body is that it supports maternal growth, in which it helps to the mother to cope with the increase in blood volume and tissue growth during pregnancy. And this also helps to reduce risk of having something we call preeclampsia in pregnancy. The recommended intake that is needed in pregnancy each day is between 400 to 800 microgram according to the WHO. And when you go for your antenatal, the amount that is given to you is usually 500 microgram, which is adequate for you every day, which is also taken once daily. So the good part is that you can take folic acid before you plan to get pregnant, and even after you are already pregnant. Thank you for listening. Like, share, comment, follow. Bye.
Gift clinic,
Healthy baby,
gift clinic,
healthy
gift
mother,
clinic,
satisfied
African desk.
no more maternal death.